Steady-state exercise, experimental methods and hypotheses. Steady-state exercise is exercise that is carried out at medium intensity, so the cardiovascular system can then work at a continuous rate throughout exercise. This means heart rate and breathing rate both stay constant without changing, as it is meeting the demands for oxygen from the respiring tissues, working muscles, being delivered via blood vessels. We conducted a test where we tested participants carrying out steady-state exercise. We compared our results in normative data and tested our hypotheses. These hypotheses were either two-tailed, single-tailed, or null. A null hypothesis is a hypothesis that there is no significant difference between specified populations, any observed difference being due to experimental error. A two-tailed hypothesis is a hypothesis without a direction, as it can fall either side and test to see if a sample is greater or less than a range of values. A single-tailed hypothesis is a hypothesis with a direction and is usually very specific in what the hypothesis predicts. Heart rate during steady-state exercise. During exercise in steady state, in the first 3 minutes, there will be an increase in heart rate, but after these 3 minutes, the heart rate will plateau out. The reason this happens is because the heart and the body are meeting the demands of exercise, as the working muscles are demanding the blood that is being efficiently supplied at this time, so the heart rate no longer needs to increase. The body can do this because of the receptors, chemoreceptors, thermoreceptors, baroreceptors and proprioceptors. They detect chemical changes, temperature, blood pressure and motor movement. They send this message to the cardiac control center in the medulla oblongata, which then sends an impulse of information to the sympathetic nervous system. This then stimulates the SA node to increase the heart rate. The amount that it increases or decreases will depend on the information received from the receptors. In steady-state exercise, the information sent via receptors will show that it is not necessary to increase or decrease the heart rate once the muscles are satisfied with the blood and oxygen levels. According to Jack Anderson, providing exercise intensity remains constant, heart rate will level off. This is known as steady-state heart rate, where the demands of the active tissues can be adequately met by the cardiovascular system. The hypothesis for the heart rate was heart rate will be seen to plateau on a graph during steady-state exercise. Normative data states providing exercise intensity remains constant, heart rate will level off. This is known as steady-state heart rate. Our method was heart rate will be monitored and measured every minute using a finger clip which measures heart rate and displays it on the screen. Normative data also suggested that when exercising there will be an increase in heart rate, where it will then plateau at about 4 minutes on average, and will then return to resting heart rate after exercise. Our data can be compared to normative data, as when exercise starts, participants experience an increase of heart rate on average of about 60 BPM between pre-1 minute and 3 minutes into exercise. Normative exercise suggests a plateau to start between 3 and 18 minutes, with a difference of 7 BPM over this time, which suggests the plateau. On average, our data, between minutes 3 and 18, we experienced a difference of 5 BPM, which also suggests a plateau and supports this normative data. Breathing rate during steady-state exercise. Chemoreceptors pick up on increased carbon dioxide concentration in the blood as the pH becomes more acidic. This CO2 needs to be expelled, and by dealing with this, the receptors send signals to the DRG within the inspiratory control center. This is found within the medulla oblongata. Depending on the concentration of CO2 in the blood, the DRG will send impulses to alter how the external intercostals contract. They do this by sending an impulse via the intercostal nerve, causing the intercostals to contract. Lifting the ribcage up and out. They do this by sending an impulse via the intercostal nerve, causing the intercostals to contract, lifting the ribcage up and out. At rest, exhalation requires no impulses as it is a passive action because the muscles used in inhalation are also used for expiration, except all these muscles do is relax, lowering the rib cage. During steady state exercise, oxygen levels don't build up because the cardiovascular system is meeting the demands of the respiring tissues, which is picked up on by chemoreceptors, and impulses are then sent to the VRG within the expiratory control center. According to PT Direct, as exercise commences, pulmonary ventilation, breathing, increases in direct proportion to the intensity, which suggests if intensity remains constant, so will ventilation. The hypothesis for this was there will be a plateau in breathing rate between 3 and 8 minutes of exercise. And the method was, during exercise, participants would inhale through the nose and exhale out the mouth to give clear indication of breaths to the people monitoring and counting their breaths for 1 minute every 4 minutes. For O'Shea, breathing rate increases rapidly in the first 8 minutes with a gradient of 1.9, which suggests a sharp increase and then decreases in gradient after 8 minutes. The gradient between 8 and 12 minutes is 1.2, which means O'Shea's breathing rate doesn't increase as fast as it did in the first 8 minutes, which suggests his cardiovascular system is not meeting the demands of the respiring tissues and is not a plateau as his breathing rate continues to increase. O'Shea's Borg scale graph suggests this gradual increase was due to him gradually increasing intensity rather than maintaining a moderate intensity, seen on slide 11. This goes against normative data, as normative data suggests the plateau will occur between 3 and 18 minutes. However, the average reading for breaths pre-1 minute was 18 breaths. This supports normative data, as the average breaths a minute at rest is between 12 and 20. Tidal volume. Tidal volume is the volume of air being inhaled and exhaled in one breath. During steady state exercise, tidal volume will increase, so more oxygen can be inhaled and more CO2 can be exhaled. This means more oxygen will be saturated with hemoglobin and can be dissociated, dissolving into the respiring tissues for energy. Once the respiring tissues are satisfied, tidal volume remains constant as there is a continuous supply of oxygen meeting the demands of these respiring tissues. Stroke volume. During steady state exercise, our stroke volume will increase with intensity until it starts to decrease at about 90 BPM. We can see this occur in this graph where the heart rate increases in a linear way. Stroke volume also starts to increase as intensity rises. However, at moderate intensity we see heart rate cross stroke volume. This shows us how heart rate is compensating for the decrease stroke volume. This is because the heart is beating too fast for the heart to refill with blood. An untrained individual's stroke volume at rest averages 50 to 70 millilitres beats per minute. 50 to 70 millilitres per beat, increasing the heart because the heart is breathing too fast for the heart to refill with blood. An untrained individual's stroke volume at rest averages 50 to 70 millilitres per beat, increasing up to 110 to 130 millilitres per beat. Compared to in elite athletes, resting stroke volume averages 90 to 110 millilitres per beat, increasing to as much as 50 to 220 millilitres per beat. This is because exercise training has increased the volume of oxygen that can be delivered to muscles per beat, so the heart needs to beat less to do the same job. An increase in contraction of muscles increases pressure of the blood as muscles contract and therefore squash the blood vessels, increasing the pressure. Therefore, this also increases the muscular pump and increases the blood's ability to return to the heart at a faster rate, and therefore Baroreceptors can pick up on increased blood pressure and send signals to the cardiac control center, increasing the amount of stretch of the heart, leading to an increase in stroke volume. The hypothesis for stroke volume was that stroke volume will increase in the first 3 minutes, then decrease as the heart rate increases beyond 90 bpm, and will then remain constant for the remaining minutes. Oxygen saturation. During steady-state exercise, oxygen saturation will decrease at the commence of exercise. However, it will start to plateau once the tissues are satisfied with oxygen uptake. According to PubMed, atrial O2 delivery during short-term submaximal exercise falls on arrival at high altitude, but thereafter remains constant. The hypothesis for this was blood saturation will decrease and then plateau after 3 minutes of exercise. And the method was oxygen saturation will be monitored and measured every 2 minutes using the finger clip, which measures O2 saturation in percent and displays it on the screen. Normative data suggests that the O2 saturation will decrease in the first 4 minutes and then remain constant. In O'Shea's case, oxygen saturation at rest is 99%. When exercise starts, oxygen decreases to 96% after 6 minutes. After this, it then plateaus and stays at 96% for 6 minutes, suggesting a plateau which supports this normative data. Oxygen dissociation. The oxygen dissociation curve shows the percent hemoglobin becomes saturated by oxygen at high and low partial pressures. The graph shows how at low partial pressures, these areas are most likely to be in areas of respiring tissue where oxygen is used up. So partial pressures of oxygen will be very low. This is because the muscles are using it up and releasing carbon dioxide. It also shows how at the lungs the partial pressure of oxygen will be very high and carbon dioxide level is very low. The graph states that partial pressures of 100 allow hemoglobin to be almost 100% saturated with oxygen. Hemoglobin usually becomes associated with 4 oxygen molecules. Oxygen molecules 2 and 3 are easier to bind at lower pressures. This is due to cooperative binding. When the first molecule of oxygen binds, it changes the shape of the second hemoglobin binding site, which aids the binding of the second and then third molecules of oxygen. The curve moves to the right when in steady-state exercise because partial pressures are much lower, as lots of oxygen is being used up. CO2 levels also increase, which increases acidity, which decreases the affinity hemoglobin has for oxygen, which then means it can only bind at higher partial pressures, and therefore the curve shifts to the right. Lactate. During steady-state exercise, lactate levels don't increase, as steady-state exercise uses the aerobic glycolysis, which doesn't produce lactic acid as a byproduct. However, the first few seconds of exercise has energy provided by ATP in the muscles, and then the ATP-PC system, which does produce minimal amounts of lactic acid as a byproduct in the first 3 minutes. However, when the aerobic system is used, lactic levels decrease as it is removed from the body. According to Lactate.com, lactate levels are increasing as the intensity of the exercise gets harder, which suggests if intensity remains the same, so will lactate levels. The hypothesis for this was lactate levels will remain the same between 3 and 18 minutes. The method was using a lactate prick, pierce the skin of participant's finger where blood will be taken and run through a machine that calculates the concentration of lactate in milligrams. Normative data suggests lactate levels will stay constant during steady-state exercise, as the dominant energy system to be used is the aerobic glycolytic system. However, normative data also states most of the lactate is being eliminated or removed by aerobic process in cells all over the body. O'Shea's data supports this because lactate levels decrease at 3 mins which suggests lactate was made in the first 3 minutes of exercise, as the cardiovascular system could not meet the demands of the respiring tissues, as the ATP-PC system